Hi everyone, this is Dr. Sangeeta and again I welcome you all to my lecture class. And in my today's lecture class, I'm going to talk about a very important topic, that is anemia. Particularly, I'm going to talk about the classification of anemia in today's class. Anemia is a very big topic, so I'm going to break the topic into different lectures. In my subsequent lectures, I'm going to talk about different types of anemia. So let's learn about the classification of anemia, or how do we approach a patient with low hemoglobin level. Now, what is anemia? Anemia means there is reduction in the red cell mass. Clinically, we look for pallor. Once a patient is pale, then we know that patient is having anemia. Now, what are the signs for looking paler? Okay, we can look at the lower palpebral conjunctiva, we can look at the oral mucosal surface, we can look at the dorsal surface of the tongue, we can look at the nail beds or palm and sole. Now, according to WHO or World Health Organization, anemia is defined as hemoglobin level less than 12 in case of females, especially non-pregnant females, and less than 13 in case of males. Now let's see, how do we approach to a patient who is having anemia, or how do we exactly classify anemia. Once a patient is pale or patient is having hemoglobin level less than 12 or less than 13 as we have discussed, then we're going to do a complete hemogram or complete blood count. Along with that, we're going to see reticulocyte production index. RPI stands for reticulocyte production index. Now, I'm going to tell you how to calculate the reticulocyte production index. For calculation of reticulocyte production index, we need to know the reti count first, reticulocyte count. Suppose if the reticulocyte count is A% and patient's hemoglobin level is B, and if our target hemoglobin is C, then reticulocyte production index is going to be okay. So this is going to be the reticulocyte production index. So that means reticulocyte production index is equal to reti count into patient's hemoglobin divided by target hemoglobin and the whole divided by 2. So, suppose if the reticulocyte production index is less than 2.5, the next what we're going to do is that we're going to look for RBC morphology. Now, RBC morphology can be of two types. Either RBC can be normocytic and normochromic, or it can be microcytic or macrocytic. Okay, so if it is normocytic normochromic, then we're going to say that this is hypoproliferative anemia. That means if the RPI or reticulocyte production index is less than 2.5 with RBC morphology of normocytic normochromic, then it will be a hypoproliferative anemia. Now, what are the causes of hypoproliferative anemia? One cause can be damage in the bone marrow, which can be due to fibrosis, or maybe due to infiltration, or maybe due to aplasia, or it can be early stage of iron deficiency anemia, or it can be due to the reduced stimulation for red cell production. The reduced stimulation can be seen in cases of inflammation, which includes different types of cancers also. Metabolic condition, like for example in hypothyroidism, and in case of renal diseases. Now, if the RBC morphology is microcytic or macrocytic, that means there is maturation defect. The maturation defect can be either in cytoplasm, or it can be a nuclear defect. If there is cytoplasmic maturation defect, the causes can be iron deficiency anemia, thalassemia, or sideroblastic anemia. And in cases of cytoplasmic defect, the RBC morphology will be microcytic and hypochromic. In cases of nuclear defect, RBC morphology will be macrocytic. And the causes can be deficiency of folate, vitamin B12 deficiency due to drug toxicity or due to myelodysplasia. So, this is about when the reticulocyte production index is less than 2.5. This is how we are going to approach a patient, or we are going to classify anemia. But if the reticulocyte production index is more than or is equal to 2.5, then what we are going to do? Let's see. If the reticulocyte production index is more than 2.5 or is equal to 2.5, then it is because of hemolysis or due to blood loss or hemorrhage. Now, these hemolytic anemias can again be further classified. So, let's look at the classification of hemolytic anemias. Hemolytic anemia can be due to the defect in the RBC itself, okay, which is known as the intracorpuscular defect, or it may be due to some extracorpuscular factor or extracorpuscular defect. Now again, both this intracorpuscular and extracorpuscular defect can be subdivided into inherited causes or acquired causes. In intracorpuscular defect, inherited cause can be different hemoglobinopathies or enzymopathies or membrane cytoskeletal defect. Okay. And acquired causes of intracorpuscular defect can be PNH or paroxysmal nocturnal hemoglobinuria. Regarding this PNH, I have already discussed in one of my class. You can subscribe to my channel and go through the lecture. Now coming to the extracorpuscular defect. Among the extracorpuscular defect, the inherited cause can be atypical hemolytic uremic syndrome. All these types of anemias I am going to discuss in my subsequent classes. And acquired causes of extracorpuscular defect can be microangiopathic or mechanical destruction of RBCs, may be due to certain toxic agents, may be due to drug induced, may be autoimmune hemolytic anemia, or may be due to certain infections. Okay, so this summarizes the classification of hemolytic anemias. Okay, and this is how we're going to approach initially to a patient of anemia, and we're going to find out what type of anemia he is having. Thank you for listening to my class. Subscribe to my channel for more classes. Thank you.